Welcome to this educational video about occupational lung diseases. These are a group of respiratory illnesses caused by inhaling dust, fumes, gases, or other airborne particles in the workplace. Understanding these diseases is crucial for protecting worker health and safety. Occupational lung diseases are primarily caused by prolonged exposure to specific substances found in certain work environments. Silicosis results from inhaling crystalline silica dust, commonly found in mining, quarrying, and construction. Asbestosis is caused by inhaling asbestos fibers, historically used in insulation and construction materials. Coal workers' pneumoconiosis, also known as black lung, is caused by inhaling coal dust in coal mines. Other causes include exposure to beryllium, cotton dust leading to bisonosis, and various organic and inorganic dusts and fumes. The pathophysiology of these diseases varies depending on the causative agent, but they generally involve inflammation and scarring of the lung tissue. In silicosis, inhaled silica particles trigger an inflammatory response, leading to the formation of nodules and fibrosis. Asbestosis involves the deposition of asbestos fibers in the lungs, causing inflammation and the development of scar tissue. This scarring thickens the lung tissue, reducing its elasticity and impairing gas exchange. In coal workers' pneumoconiosis, coal dust accumulates in the lungs, leading to the formation of coal macules and, in more severe cases, progressive massive fibrosis. These processes ultimately impair lung function and lead to breathing difficulties. The epidemiology of occupational lung diseases varies depending on the industry and geographic location. Silicosis is prevalent in countries with significant mining and construction industries. Asbestosis was more common in the past due to widespread asbestos use, but remains a concern in older buildings and demolition work. Coal workers' pneumoconiosis is primarily found in coal mining regions. Effective workplace safety regulations and preventative measures have reduced the incidence of some of these diseases in developed countries, but they remain a significant health concern in many parts of the world, especially where safety standards are lax or unenforced. The signs and symptoms of occupational lung diseases often develop gradually over years of exposure. Common symptoms include shortness of breath, cough, wheezing, and chest tightness. As the disease progresses, individuals may experience fatigue, weight loss, and difficulty breathing even at rest. In advanced cases, complications such as pulmonary hypertension and respiratory failure can occur. Diagnosis typically involves a combination of medical history, physical examination, lung function tests, and imaging studies. A detailed occupational history is crucial to identify potential exposures. Lung function tests, such as spirometry, can assess lung capacity and airflow. Chest X-rays and CT scans can reveal characteristic patterns of lung damage, such as nodules, fibrosis, or pleural plaques. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. Occupational lung diseases can be classified based on the causative agent and the severity of the disease. For example, silicosis can be classified as acute, accelerated, or chronic, depending on the rate of progression. Coal workers' pneumoconiosis is often classified as simple or complicated, based on the size and extent of the lung lesions. Asbestosis is typically classified based on the degree of lung fibrosis. Each classification carries different implications for treatment and prognosis. Unfortunately, there is no cure for most occupational lung diseases. Treatment focuses on managing symptoms and preventing further progression of the disease. This may include bronchodilators to open airways, corticosteroids to reduce inflammation, and oxygen therapy to improve oxygen levels. Pulmonary rehabilitation can help improve lung function and quality of life. In severe cases, lung transplantation may be considered. Prevention is the most effective strategy for combating occupational lung diseases. This involves implementing strict workplace safety measures to minimize exposure to hazardous substances. Engineering controls, such as ventilation systems and dust suppression techniques, can reduce airborne concentrations of dust and fumes. Workers should be provided with appropriate personal protective equipment, such as respirators, and trained on safe work practices. Regular medical surveillance, including lung function tests and chest X-rays, can help detect early signs of disease. The prognosis for occupational lung diseases varies depending on the severity of the disease and the individual's overall health. In many cases, the disease is progressive, leading to chronic respiratory impairment and reduced quality of life. Recent research is focused on developing new therapies to reduce inflammation and fibrosis. Studies are also exploring the use of biomarkers to detect early signs of disease and monitor treatment response. Advances in imaging techniques and lung transplantation offer hope for improved outcomes in some patients.